Arthritis is one of the most common causes of disability and lost days from work in the world. And osteoarthritis is the most common form of arthritis that affects people. Let us take a look at some of the causes and treatments of this common disease. Arthritis is the word used to describe inflammation of the joints. There are several types of arthritis, including infectious arthritis, osteoarthritis, psoriatic arthritis, and rheumatoid arthritis. Osteoarthritis is the most common form of arthritis, and its incidence and prevalence are increasing around the globe. In today's video, we'll take a look at osteoarthritis. Osteoarthritis was originally thought to affect mainly the cartilage as a result of mechanical overloading that led to degeneration and loss of cartilage. We now know that there is inflammation in the entire joint, including the cartilage, the bone, the lining of the joint capsule or the synovium, as well as the ligaments and the muscle. The joints that are most frequently affected are the hands, the hips, the knees, and the spine, but almost any joint can be involved. Osteoarthritis most frequently occurs in older persons, and in the over 60 population, about 10% of men and 13% of women are estimated to suffer from osteoarthritis. Obesity is a major risk factor for osteoarthritis, and previous injuries to the joint as well as mechanical stresses to the joint frequently lead to osteoarthritis in later life. Repetitive actions such as lifting heavy loads, kneeling, and playing professional sports like football, long-distance running, or hockey are often associated with an increased risk of osteoarthritis. On the other hand, a lack of exercise can cause muscle weakness and joint instability, which can lead to osteoarthritis. It is clear there's a genetic basis to the disease, as well as a propensity to occur with greater frequency in women than in men. Some researchers have found that low levels of vitamin C and vitamin K increase the risk of osteoarthritis, but strangely enough, vitamin D did not affect the loss of cartilage in patients with osteoarthritis. The bones in the joints are covered by cartilage on those surfaces that come into contact with each other. The cells in the cartilage have receptors on their surface that can sense load and stress in the cells. Moderate pressure, for example during moderate exercise, can stimulate the cells to make molecules that can nourish and protect the structures in the joint. If the mechanical load becomes excessive, it can cause the cells to make inflammatory molecules like interleukin 6 and tumor necrosis factor alpha. These molecules irreversibly damage the structures in the joint, the cartilage, the bone, and the lining of the joint capsule, the synovium. Recently, the connection between being overweight and osteoarthritis has been attributed to hormones produced in the fat tissues in the body like leptin. Researchers believe that leptin is involved in the pathogenesis of osteoarthritis because osteoarthritis sometimes occurs in joints that are not mechanically loaded or stressed. They believe leptin produced in the fat tissues causes a chronic inflammatory process that induces cells in the synovium and the cartilage to produce molecules that destroy the structures of the joint. High levels of leptin in the joint fluid and in the blood of patients suffering from osteoarthritis support this theory. Osteoarthritis causes degeneration that can present as swelling and stiffness that increases with use, along with pain and loss of mobility. When it appears in the hands, it can be accompanied by lumps of bony tissue known as nodes. Heberden's nodes and Bouchard's nodes on the last and the middle joints of the fingers, and the involvement of the joints can be asymmetric. Traditional treatment is aimed at pain control and prevention of progression of the disease. Acetaminophen is often started as initial therapy and advanced to anti-inflammatory medications known as NSAIDs. If these measures fail, Patients can be treated with injections of corticosteroids and hyaluronic acid into the joint. Treatment of severe cases that are resistant to medical therapy is total arthroplasty or joint replacement surgery. Some complementary or alternative treatments have shown some benefit, and the combination of glucosamine and chondroitin appear to be effective in moderate to severe osteoarthritis of the knee. Some studies have shown benefits with injections of platelet-rich plasma into the joint. Blood is first collected from the patient and centrifuged to collect platelet-rich plasma, which is then injected. Mesenchymal stem cells, which are cells that are able to differentiate into other types of cells and which have been collected from the bone marrow or from the fat tissue, have also shown promise in some studies. And regrowth of cartilage in the joint has been reported in at least one study. Health insurance companies in some countries still require proof of the efficacy of these treatments and still do not pay for these injections. Newer drugs in the pipeline include monoclonal antibodies, leptin binding molecules or antagonists, as well as gene therapy, but more clinical studies are needed to confirm the efficacy and safety of these methods. Thank you for watching. I hope you enjoyed the video. Like and share it with friends and family, and support this channel by subscribing. Don't forget to hit the notification bell so you can receive notification when new videos come out.